The latest news, updates, and more from the world of health and medicine. This is Medical Minutes, brought to you by Community Health Network.
Summer may be slipping away, but a very serious health issue from it is still very much a problem. And it is our morning checkup, West Nile virus. Medical expert Dr. Janelle Gordon is here with some advice on how to deal with it, how to get ahead of it so that you don't even have to have this problem in the first place. Numbers are pretty daunting this year. What's happened?
Very interesting. So what we're being told is this time of year is the peak season for mosquitoes, and the rates or cases for West Nile virus are actually up 40% per usual.
That's national numbers. Like, we're talking hundreds of people who are ill with it. What about Indiana? Are we following that trend?
Yes, so actually our first case here in the state took place in Vanderburgh County back in July, and since then we're up to 15 total cases. Majority of those being more severe, affecting the nervous system.
Let's talk a little bit about symptoms, whether it's nervous system or some of the, I don't want to call them lesser symptoms because they're all really unpleasant, but when this first started, we all knew them by heart. Over the years, it's gotten fewer and fewer headlines, but the symptoms are still pretty rotten.
Can be pretty terrible. So I do remember when we first started hearing about West Nile virus, and then it kind of went away, but the cases haven't.
Right.
And they've progressively continued to stay around. And so most individuals actually won't have any symptoms, and that's likely why we typically don't hear much about it. Oftentimes, individuals may have flu-like symptoms, which would include a fever, mouth fever, some nausea, vomiting, possibly even a rash. However, a lot of individuals also can experience neurological symptoms, and that can include inflammation of the brain and spinal cord, as severe as paralysis and even death, Scott.
Well, that's all fairly terrifying. So at what point do you seek treatment? If you just have, I don't want to say just, but if you just got a couple of the flu-like symptoms, just deal with it, or do you recommend going to a doc right away?
Great question. So oftentimes these symptoms will be self-limiting, and you won't even need to seek further care. However, if the symptoms aren't getting any better, and definitely if you start noticing any neurological symptoms, if you're having some confusion, dizziness, changes in sensation, difficulty walking, you need to be seen emergently.
And the doctor can help you figure out whether it is West Nile virus or something else that may have similar things like that. This is all really about avoiding mosquitoes, right?
Yes, but how do we do that?
Right.
I mean, every time you go around, there are mosquitoes. Honest to God, around this time of year, I make sure I always have insect repellent with me. For some reason, these bugs seem to be very attracted to me. So make sure that you do have an EPA-registered insect repellent.
Okay.
Make sure that you're minimizing breeding grounds, especially around the home. So even a bottle cap can be a harboring site for these mosquitoes. So get rid of any type of container that could cause water to be drawn to it. And then if possible, make sure that you have screens on your windows as well as your doors when you're out and about this time of year. Although we all like to look nice in our summer wear, loose-fitting, long-sleeve shirts and pants are going to be your best bet. And then, as always, if symptoms aren't getting better, if you do find yourself to have been struck by a mosquito, please seek medical evaluation.
We have a big rain barrel in the yard, and I never think about it. And I will bet you that there's a nice little mosquito bed in there right now. I need to deal with that.
Today.
Don't I turn into a breeding ground for the family and my neighbors. Doc Gordon, thank you very much for being with us today. Dr. Janelle Gordon, our medical expert.
This is Medical Minutes, brought to you by Community Health Network. Learn more and get more with Wish TV. Online at wishtv.com, and when you follow Wish TV on Facebook, be sure to check out more great podcasts from the All Indiana Podcast Network now at allindianapodcastnetwork.com.